Now, this new revelation means prevention strategy will have to change. But how? Let's find out from the health economics and finance expert, and that's Professor Alex van der Heever from the Wits School of Governance. Prof, a very good morning to you. So you are among those who are strong believers in COVID-19 now being transmitted through the air. But government officials are going to say to you, where is the clinical evidence to support that theory?
Well, there's a lot of circumstantial evidence to support it because a lot of the infections that are being detected in many environments can't be explained in any other way than if the virus were airborne. And even if it weren't, it makes sense at this point. Let's say if it's not conclusive, it makes sense to be absolutely cautious and to be belts and braces about managing the epidemic. Yeah. Because we have a lot of high-risk environments that where you will get infected if this is true.
Now, Gauteng's COVID-19 infection rate is alarming, to say the least. My question to you simply is, where there is super spreading of this virus, particularly in this province, could the element of it being airborne be factored in?
Yes. We still have inadequate protections around bulk transport, around a lot of employment spaces, spaces of employment, stores, etc. So any place where you've got poor ventilation and people are indoors, even if they're wearing some form of PPE, they're at high risk of being infected if they're going to be in the vicinity of other people with the virus or people who previously were in that space with the virus for any prolonged period. So the longer you're in that space, the greater the chance you're going to get a sufficient dose to be infected. So the issue is to really look very carefully at which of those spaces need to have an additional layer of protection, which typically involves quite low-cost interventions in many settings. But where you have to change what you're doing. So, for instance, in taxis, it would make absolute sense for them to drive with their windows down. So that doesn't cost anybody anything. Yeah. But you need ventilation in those spaces. So ventilation is quite critical to mitigating this particular risk in many settings, as well as looking at the air conditioning systems.
Professor, the WHO has come out to say what you are suggesting is circumstantial evidence is simply not conclusive. The next question, therefore, becomes, how do people protect themselves in the meantime? Will social distancing and the wearing of masks, which you've just touched on, still be an important safeguard?
Yes, so WHO is typically a few months behind the science and at least the risk management of the epidemic, I'm afraid. In these contexts, it doesn't take much. It's not a huge change in strategy. It's an enhancement of existing strategies that are required. And it would make absolute sense to protect yourself and to protect others by being aware that this is a further risk. And in many places in South Africa, we can't really explain why a whole bunch of people are being infected in certain environments, such as pharmacies, in other workspace call centers, schools and shopping centers. And the only explanation is this. So the question really is, what are the additional layers that need to be implemented? And the problem with WHO and waiting for the absolute final evidence is that when the evidence is finally conclusive in this, we've lost 3 to 4 months in prevention. So if it doesn't cost a great deal, and people need to be aware that this is a risk, that's really how you treat epidemics as well. You manage the risk.
Prof, let's keep the attention on Gauteng, which is fast becoming the epicenter, it has been said, of this virus. And I'd like for you to put your head on the block and tell me, if you were to do a comparative study between Gauteng's prevention strategies versus the Western Cape, which province is managing this virus better?
Well, on the outcomes, the Western Cape appears to be a lot more successful than Gauteng. It's difficult to assess the Gauteng's actual prevention strategy because not a lot of it is in a public or strategic document. So if I go to a lot of places, I would actually have an explicit strategy that tells us exactly what they're doing. In the Western Cape, they did have one. So I've read the strategy and understood what they were doing. And when they ran out of, when the testing became very difficult to keep with one strategy, they altered it. So they were changing strategy when circumstances also changed.
Can I interrupt you for a second there, Prof? And I'm sorry to cut in. Are you saying that Gauteng has no definitive strategy to try and prevent this? And that would be alarming if you say yes, because preparation has been ongoing, we were told, since March.
Well, if they've got an express strategy, I haven't seen it. And a strategy document, that's what I'm really referring to, which tells you exactly what they're doing and how and why, is essentially not there. There might be a strategy behind the scenes. It's unclear. So what we're seeing at the moment is that whatever strategy is there has not worked and is not working from a prevention perspective. And prevention in this epidemic is absolutely key. We can't manage this epidemic with health services alone. So there's this narrative that has been presented both by the Gauteng MEC and by the National Minister, which has suggested that there was some sort of coming storm. This is not true. If that was their strategy, their strategic objective was to wait for a storm, then I'm afraid we failed because they were actually preparing and expecting failure. What we needed to have was a prevention strategy that never saw what we're seeing now. This was never predicted or projected. It's something that you manage through your policy and how you implement it. So what we were seeing in the Western Cape was an explicit, express strategy that modified as circumstances changed, and you can see it in the outcome on the epidemic. It may still change. The Western Cape could still run into trouble again, but you can see the effect in the trajectory. In Gauteng, we see an unmanaged trajectory. It looks like there's substantial super spreading going on, and it's not managed. And
how will
that suggests a failure of strategy.
How will you respond to a response perhaps from the MEC in Gauteng, Bandile Masuku, saying you could possibly be a hired gun for the Western Cape government, because where's the evidence to back up what you're saying, that they simply do not have a strategy? And I'd like you to also keep in mind the element about capacity that has been raised by unions in Gauteng, that space in hospitals is fast running out, both from private and the public sector.
I think if they were to raise that I'm a hired gun, they'd have to prove it. It's got absolutely nothing to do with the DA versus the Gauteng versus the ANC. What we're looking at is the evidence. What is the outcome of the epidemic? That is as concrete as it gets. That is your evidence. If you're not suppressing the epidemic, then you failed. And then a question of comparing strategies comes down to looking at whether or not you achieve results, not whether or not you've got lists of bullet points on a PowerPoint. So the issue of an express or explicit strategy, a document, the release of routine data and information telling us what you're doing, that's missing in Gauteng, and it's missing in a lot of the other provinces and at national. So these are issues that need to be addressed in order to attack an epidemic. And if you do an international comparison of best practice, we haven't been doing it. And in the countries that do testing and tracing at scale, that they have an express strategy around how they're suppressing the epidemic, it works. It's difficult, but it works.
All right.
But what we're seeing now is an uncontrolled outbreak, which is extremely worrying, and many people are going to die as a consequence of a failed strategy. And that's what government has to answer to. They must answer to a failure.
Sure. Very strong words there. Professor Alex van den Heever, he is with University of Witwatersrand. Well,